Good morning. Senator Murray is on her way, but she's asked that I go ahead and begin because she has double duty today. Well, the fact is, she's here. You know, there was many years ago, Senator Everett Dirksen of Illinois was a little bit theatrical. Senator Murray's not theatrical, but Senator Dirksen was, and when he would speak at an event, he would wait in the back of the room until he was introduced and people would begin the applause. And then he would walk very slowly to the front to extend the applause for a long period of time. So Senator Murray has double duty today. She's managing the Labor, Health, and Human Services appropriations bill on the floor, and she's here. So I want to recognize that and compliment her on that piece of legislation because it has a variety of good things in it. And again, I believe it takes an important step in increasing funding significantly for biomedical research at the National Institutes of Health. She and Senator Blunt have led that effort, and I and others support it. They've set priorities within the budget limits, and it's good for our country. The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Senator Murray and I will each have an opening statement. I'll introduce the witnesses, then we'll hear from the witnesses, and senators will have 5 minutes to ask questions. As any American, even the Secretary of the Department of Health and Human Services knows, it can be difficult to find out how much a simple health care test will cost before a doctor's visit. Secretary Azar recently told the story of his doctor ordering a routine echocardio stress test. Secretary was sent down the street and admitted to the hospital where, after a considerable effort on his part, he learned the test would cost him $3,500. After using a website that compiled typical prices for medical care, he learned the same test would have cost just $550 in a doctor's office. Secretary Azar said that consumers are so in the dark they often feel powerless. The internet's made it easier for consumers to know more about what they want to purchase before they actually buy it. You can easily read an online review and compare prices for everything from a coffee maker to a new car. This is true for everything else, but not for health care. The cost of health care has remained in a black box. Any one of us who has received a medical bill in the mail has wondered what we're actually paying for. For years, patients were more or less okay with that because insurance companies and the government paid most of the bills. However, as premiums have increased, more Americans are covered by plans with high deductibles, which means they're often paying lower monthly payments for their premiums in exchange for spending more out of pocket when they go to the doctor or fill prescriptions. According to the Kaiser Family Foundation, half of all single covered workers in 2017 had a deductible of at least $1,000, which is Kaiser's threshold for a high deductible. This is an increase from 34% in 2012. And because Americans themselves are footing more of their health care bills, more are showing an interest in shopping around, as Secretary Azar did when he had his heart test. Today's hearing is the fourth in a series on reducing the cost of health care. It's an opportunity to learn how we can improve what information is easily available about the cost and quality of health care so patients can make their best health care decisions for their families, themselves, and their wallets. Without better information, health care stays in that black box, making it hard for Americans to be good consumers, make good decisions, and pay reasonable amounts for necessary health care. Senator Paul, a member of our committee, has talked about how with an elective surgery such as LASIK, a patient is more likely to call doctors' offices to find the best price, calling an average of 4 different doctors to find the best price for that corrective eye surgery. As patients have shopped around for LASIK, the price started to dramatically decrease. It's gone down 75% over the last 15 years, according to Senator Paul. The black box also disguises the quality of care. This is important because we think often that high cost equals high quality. For example, Stephen Joel Trachtenberg, who has spoken freely about raising tuition to raise the profile of George Washington University while he was president has said, quote, "People equate price with the value of education," unquote. While the price of tuition, unlike healthcare, is easily available on universities' websites, deciphering the quality of education and healthcare is hard. Improving transparency in healthcare prices and quality is an area where the private sector and states are largely leading the charge. For example, medical centers like the Surgery Center of Oklahoma and St. George Surgical Center, one of our witnesses today, list the prices for the surgeries they offer on their website so patients know up front how much their surgeries will cost. Healthcare Blue Book, represented by another witness, is a tool that helps employees find the best price for the highest quality care in their area using their employer-sponsored insurance. This is a useful tool to lower costs because, for example, the amount a patient pays for cataract surgery in Memphis can range from as little as $2,000 to more than $8,000. In 2017, the state of Maine passed a bill requiring health insurers to split the savings with a patient if the patient shops around and chooses a doctor that is less than the average price the insurer pays. In Oregon, the state compiles data on insured residents and uses this information to run a tool similar to Healthcare Blue Book that allows patients to compare the costs of procedures used at different hospitals. While the private sector is largely leading the charge in making healthcare information more easily available, the federal government can also play a role, and witnesses today can inform us about steps that we can take. Secretary Azar told the story of finding out the price of his heart test in a speech, announcing that the administration would focus on increasing price transparency. For example, in April, Centers for Medicare and Medicaid Services Administrator Seema Verma announced that by January 2019, hospitals that participate in Medicare or Medicaid must list their current standard prices online. In an age when you can compare different prices and check a dozen reviews when shopping for a new barbecue grill, Americans should be able to know more about the cost of their health care. Senator Murray.